Is turmeric a good treatment for your joint pain and arthritis? Believe it or not, turmeric can help people with joint pain and arthritis. And yes, there are trusted medical studies that show that turmeric can be as effective as Tylenol, that was a study in 2021, and as effective as a prescription anti-inflammatory medicine. But it's not that simple. First, everything has risks, be it prescription medicines, over-the-counter medicines, or these nutraceuticals. It's actually the substance curcumin that's in turmeric that is believed to be responsible for its beneficial effects. It's an anti-inflammatory. Turmeric and all the nutraceuticals are actually not regulated by the FDA. So the reality is you don't really know what you're getting in the capsule. My recommendation is always go with a reputable, known brand. They do their own internal testing and it's safer. Another challenge with turmeric, we don't really know the right dose. Now, most studies show effective doses are 1,500 to 2,000 milligrams of curcumin, the active ingredient in turmeric, is effective. But another thing about turmeric is it's fat soluble. And so ideally, you don't take it on an empty stomach. In fact, you can take it with fatty foods or find a turmeric supplement that has the essential oils with it. Turmeric is proven to be effective in some clinical situations. There are risks. Watch the maker of turmeric and watch the dose. More details on turmeric to come.